To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, it's February, which means it is Heart Month, and I am joined by Dr. Ameer Kabour from ThedaCare, the cardiovascular care team. Welcome, doctor.
Thank you. Glad to be here.
Well, I'm glad you're here because we are talking Heart Month, and maybe we can get into why do we need just to take a breath and think about that heart in February.
You know, it's very important month because it will raise the national awareness about heart disease and remind the population and also the physician providers how to take care of heart disease at the right time and the best way possible to minimize the chance of doubling the heart disease in patients number in the next 25 years.
And that is crazy to think about. So if we're thinking about the patients doubling in size, what are some things that we can do right now to reduce that risk?
Believe it or not, it's the same thing we always say. Don't smoke. It's important. Eat healthy. Get your blood pressure under control. And believe it or not, it's so important to do that. Know your family history because family history is so important. Lose weight, lower your cholesterol, and monitor your blood sugar and be active exercise-wise.
Yeah, and those are great words that we hear. And of course, always checking in with the doctor to hear that, even though we know it is an important thing. I wonder if when should we think about seeing a specialist? When does that happen?
You know, usually we consider the primary care physician as the captain. He can determine which the condition needs to see a specialist. But to see a heart doctor when you're having significant symptoms like rhythm problem and heart disease and blockages needs to be treated, that's when you should go to the specialist to manage those main problems for yourself. But I believe that primary care physician should be the first person to go to when you're having any symptoms like chest pain, trouble breathing, palpitation, fluttering, passing out. Those are very important, commonly seen in the public.
And I would think that even, everybody knows their own body, but if you think it's off just a little bit, we should talk to our general physician, correct?
Absolutely. Always he is the captain to start with.
All right. Well, doctor, thank you so much for walking us through Heart Month, which we should all take a breath, think about what we're doing, what we're eating, and remember the old ticker, right?
Thank you for the invite.
All right. Thank you, doctor, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.